Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on your journey to a 250. This video is all about neurotransmitters. So, which of the following side effects is the patient most likely to experience as a result of the medication's mechanism of actions? A 28-year-old woman diagnosed with major depressive disorder is prescribed a novel medication as part of her treatment regimen. This medication acts by modulating the neurotransmitter levels in the brain and primarily inhibits the reuptake of dopamine. The prescribing physician aims to enhance dopaminergic neurotransmission in specific brain regions. The patient is informed about potential side effects, and the physician monitors for adverse reactions during follow-up appointments. Which of the following side effects is the patient most likely to experience as a result of the medication's mechanism of action? Sedation, weight gain, sexual dysfunction, extrapyramidal symptoms, or dry mouth. Now, the medication described is designed to increase the availability of dopamine in the synaptic cleft by inhibiting its reuptake. Dopamine, a neurotransmitter, plays a crucial role in various physiological functions, including mood regulation and movement. So the correct answer becomes extrapyramidal symptoms. Okay, whenever there is increased dopamine, the patient may show extrapyramidal symptoms. Talking about sedation, medications that increase the dopamine levels are more likely to be associated with alertness and wakefulness rather than sedation. The patient is being treated for depressive disorder. We want the patient to be alert. Okay, we want the patient to be wakeful because the patient is already sleepy and a lazy type. Okay, in case of weight gain patient, the weight gain is often linked to medications affecting serotonin and other neurotransmitter rather than dopamine. Sexual dysfunction side effect is commonly associated with medications affecting serotonin, such as SSRI, rather than dopamine inhibitors. Now, the extrapyramidal symptoms, the increased dopamine levels in specific brain regions can lead to extrapyramidal symptoms, including tremors, rigidity, and bradykinesia. And this is a side effect often seen with medications that affect the dopamine, particularly those used in the treatment of psychosis. Dry mouth is more commonly associated with medications that have anticholinergic effects rather than those that affect the dopaminergic reuptake. A 35-year-old man is prescribed a new medication for the treatment of generalized anxiety disorder. This medication acts by enhancing the serotonin levels in the synaptic cleft through selective inhibition of serotonin reuptake. Now, the patient is educated about potential side effects and routine follow-ups are planned to monitor his response to the treatment. Which of the following side effects is most likely associated with medications that selectively inhibit serotonin reuptake? Now, you might be able to answer this question because we have already discussed this in the previous question. Extrapyramidal symptoms, weight gain, sexual dysfunction, hypertension, or dry mouth. Pause the video and think what is the answer. So, the medication described is a selective serotonin reuptake inhibitor commonly used to treat anxiety disorders and depression. SSRIs increase the serotonin levels in the synaptic cleft by inhibiting its reuptake, leading to enhanced neurotransmission. So, the correct answer is sexual dysfunction. Talking about extrapyramidal symptoms, which are generally associated with dopamine, okay, they include tremors, rigidity, and bradykinesia, and particularly those used, particularly associated with drugs that are used in the treatment of psychosis. Now, weight gain is a potential side effect of some psychiatric medications, but is not the common side effect of SSRI. Sexual dysfunction, including decreased libido and difficulty achieving or maintaining an erection in men, or difficulty reaching the orgasm, is a well-known side effect of SSRI. Now, this side effect of SSRI is most commonly tested if they want to test you about the SSRI medication used in the psychiatric symptoms, psychiatric conditions. Hypertension, SSRI are generally not associated with hypertension. In fact, they may have a mild hypotensive effect in some individuals. Talking about dry mouth, which is more commonly associated with medications that have anticholinergic effects rather than SSRI. Now let's talk about one more question here. Which of the following mechanisms best describes how this medication exerts its anxiolytic effects? Now, a 45-year-old woman is diagnosed with generalized anxiety disorder and is prescribed a medication that enhances the activity of gamma-aminobutyric acid in the central nervous system. The medication acts by binding to a specific site on the GABA-A receptor and facilitating the inhibitory effects of GABA. Which of the following mechanism best describes how this medication exerts its anxiolytic effects? Inhibition of GABA synthesis, inhibition of GABA degradation, facilitation of GABA release, blockade of GABA receptors, and facilitation of GABA-A receptor function. So GABA is the major inhibitory neurotransmitter in the central nervous system. Medications that enhance the activity of GABA-A receptors, such as benzodiazepines, increase the inhibitory effects of GABA, leading to anxiolytic or anxiety-reducing effects. So the correct answer is facilitation of GABA-A receptor function. Inhibition of GABA synthesis would reduce the availability of GABA, leading to the decreased inhibitory effects and potentially exacerbating anxiety. Inhibition of GABA degradation would increase the GABA levels, but this would not enhance the GABA-A receptor function, and the net effect on anxiety may be unpredictable. Facilitation of GABA release could increase the GABA availability, but the anxiolytic effects are more reliably achieved by directly enhancing the GABA-A receptor function. Blockade of GABA receptors will lead to decreased inhibitory effects of GABA, potentially worsening anxiety. Facilitation of GABA-A receptor function. Medications that facilitate the GABA-A receptor function, such as benzodiazepines, enhance the inhibitory effect of GABA, resulting in anxiolytic effects. Now let's talk about one more question here. So according to this hypothesis, which of the following neurotransmitter imbalances is most commonly associated with the pathophysiology of MDD? So a 30-year-old woman with a history of recurrent episodes of depression characterized by low mood, fatigue, and diminished interest in activities seeks evaluation for a potential mood disorder. Now, during the clinical assessment, the clinician explains the role of neurotransmitter imbalances in contributing to mood disorders. The monoamine hypothesis is discussed, suggests that alterations in the certain neurotransmitters may underlie major depressive disorder. So according to this hypothesis, which of the following neurotransmitter imbalances is most commonly associated with the pathophysiology of MDD? Increased serotonin and norepinephrine, decreased serotonin and increased dopamine, decreased serotonin and norepinephrine, increased serotonin and decreased dopamine, increased dopamine and decreased norepinephrine. So the monoamine hypothesis proposes that imbalances in specific neurotransmitters, notably serotonin and norepinephrine, contribute to the pathophysiology of major depressive disorder. Understanding the prevailing neurotransmitter imbalances is crucial for tailoring effective treatment strategies for individuals experiencing depressive symptoms. So the correct answer is decreased serotonin and norepinephrine. So the increased serotonin and norepinephrine, that is the option A, contradicts the monoamine hypothesis, which posits decreased level of these neurotransmitters in MDD. Decreased serotonin and increased dopamine. While imbalances in dopamine may be relevant to certain mood disorders, MDD is more strongly associated with decreased serotonin and norepinephrine. So the monoamine hypothesis suggests that reduced level of serotonin and norepinephrine contribute to the development of major depressive disorder. This is just a statement that you need to remember, and this is a typical USMLE step 1 style question. The increased serotonin and decreased dopamine, this combination does not align with the commonly observed neurotransmitter imbalances in the MDD. Increased dopamine and decreased norepinephrine, similar to option D, this combination is not typically associated with neurotransmitter imbalances which are seen in the MDD. Thank you for watching. Keep studying hard.